Gaza doctors becoming too weak to treat patients as hunger crisis deepens. July 24, 2025. Doctors in the Gaza Strip are warning that they are becoming physically too weak to care for patients, as the territory's deepening hunger crisis pushes its collapsing healthcare system to the brink, with supplies of food, water, and medicine critically low after months of conflict and blockade. Medical staff report they are increasingly unable to function, working long hours on empty stomachs in overcrowded, under-equipped hospitals filled with injured and malnourished civilians. Doctors on the edge of collapse. We are exhausted. Many of us are fainting during surgeries. Some cannot even stand through a full operation, said Dr. Hani al-Kahlout, a senior surgeon at Gaza City's Al-Shifa hospital. We treat others while our own bodies fail us. The humanitarian situation has worsened dramatically in recent weeks, with aid agencies reporting a near-total breakdown of food distribution systems. Malnutrition, once rare in Gaza, is now widespread, affecting not only children and the elderly, but also frontline medical personnel. We're seeing cases of hunger and dehydration among doctors and nurses. It's something I've never witnessed before, said a representative of Médecins Sans Frontières. Doctors Without Borders working in Rafah, hospitals under siege. Hospitals that once served as the last line of defense are now overwhelmed. Beds are filled with trauma patients from airstrikes and shelling, while others suffer from complications related to starvation and treated chronic conditions and infections caused by poor sanitation. Electricity is unreliable, medical equipment often unusable, and medicine stocks dangerously depleted. Staff must make impossible decisions about who receives care and who doesn't, all while battling their own physical decline. We are watching children die from preventable causes because we simply don't have the capacity to treat them, said Dr. Mariam Issa, a pediatrician in northern Gaza. The world must understand this is not just a humanitarian crisis, it's a collapse. Worsening blockade. Scarce aid. The worsening crisis stems from a combination of ongoing conflict, a harsh blockade imposed by Israel, and severe restrictions on humanitarian aid. International organizations have repeatedly called for safe corridors to allow life-saving supplies into Gaza, but aid remains sporadic and insufficient. Unofficials have described the situation as beyond catastrophic, with famine looming in multiple parts of the enclave. Doctors and patients alike are starving. This is a deliberate strangulation of an entire population, said Felipe Lazzarini, head of UNRWA, the UN's Agency for Palestinian Refugees.